Hi, I'm Daniel Cruz with Cruz Strategic Consulting, talking about direct primary care today. What is it exactly? Direct primary care is a model of physician primary care that creates a direct relationship between the doctor and the patient. Instead of having an intermediary like an insurance company or hospital, the patient pays the doctor directly, much like a cash pay patient. A key difference is that with direct primary care, there's a membership fee that the patient pays every month, similar to a gym membership. The benefit to this is that the patient can see the doctor whenever they want for no extra money. They can get same day or next day appointments and much more time with the doctor. We're talking like at least 30 minutes and many times more at first. Imagine the impact of this style of care. With all the additional time with the patient, the doctor is better able to do their job, which is to get to know the person so they can diagnose and treat them more holistically. This frankly isn't happening with typical primary care, and it's sad. Most people are lucky if they get a good 10 minutes with their doctor. Even with more nurse practitioners, the time with patients is still suffering, which means people are suffering. Yeah, not good. Direct primary care memberships aren't cheap, so it makes it hard for the average person to afford it. Monthly fees range from $50 to $80 a month for just one person. Family memberships can be close to $200 a month. While that may seem pricey, it does make sense for someone who has a higher income or someone with a high deductible plan or medical sharing program. They either have enough money or are saving enough on their other healthcare expenses to afford it. But that's not most people. This means that as amazing as direct primary care is, it's not become normal yet, and most people still haven't heard of it. So why did I tell you about this great healthcare option if you can't have it or can't afford it? Well, there's a solution, and it's simple. Employers have to step up and cost share direct primary care. That's how it has to work. It's where the majority of people get their health care anyway, so it just makes sense. If you only paid $10 to $20 a month, and if it was a part of your employee benefits at work, then it becomes possible. Not only possible, but a no-brainer. There are health benefit programs out there that give discounts for having direct primary care, making it even more cost-effective in an employer plan. A few other perks of direct primary care is that most DPCs have wholesale lab costs and pre-negotiated deals with imaging or diagnostic services. Some also have wholesale prescription drug programs and keep some basic medications on site. Nearly every major city has at least one direct primary care clinic. Just in Fort Wayne, Indiana, with a metro population of around 400,000 people, there are 3 different clinics. Availability isn't the main problem, but cost. Many doctors are itching to get into this kind of arrangement because they, of all people, see the problems in primary care. And because you're getting the time you need with your doctor, you're also less likely to need a specialist. So employers need to get in the game on this. It will keep employees healthier, they'll have fewer sick days, and they actually can have a doctor help them manage their chronic conditions more intensely. As an employer, if you're doing some kind of self-funding for healthcare, direct primary care, based on hard data, drastically lowers costs because people will have fewer ER visits, hospitalizations, and surgeries. Yes, all the big medical costs are massively reduced, especially for your most health at-risk employees. Like I said, no-brainer. If you want to know more about direct primary care and how you might get it yourself, let me know. There are still so many people who don't know this even exists. So like this video and share it with your friends and connections. So until the next one, stop wasting money and get better healthcare.